Welcome to Lecto. Today we are going to discuss ESR, or you can say erythrocyte sedimentation rate. Erythrocytes mean RBCs. Sedimentation rate, the time in which the RBCs will settle in the tube, specifically ESR tube. So it is actually a test in which we will measure the time in which the RBCs will settle in the tube. So due to the different timing of the RBC settling, we can detect or we can measure the different factors and the different diseases. So in this case, if you see, first of all, in normal situation, when we extract or draw the blood, then after its drawing, it will immediately form a clot. So we have to prevent the formations of the clot. So in this case, we extract the blood in the tube having already present anticoagulant. So anticoagulant actually prevent the formations of the blood clot. So if you see here, like this is the tube. In this tube, we take the anticoagulant. Anticoagulant is already present in this tube. Okay. When we add the blood in this tube, after adding blood in this tube, we will mix it properly so that blood and the anticoagulant mix proper. Okay. After that, we will see when we stay this tube for some time, then after that you will see the formation of three most important layer. So in a bottom will be the layer, and this layer is the layer of RBCs. Okay, and after that you will see the formation of middle layer, and middle layer will be the buffy coat. So here is this middle layer, and this is actually the buffy coat. But in the buffy coat, you will see the two most important components of the blood, that will be the white blood cell and the platelets. So these are basically the two most important components. And the last will be the plasma that is actually present in the blood. So this is the plasma layer. So you will see the formation of three most important layers: RBCs, buffy coat, in which you will see the WBCs and platelets, and the plasma. Okay, we will notice the time 1 hour. In 1 hour, how much RBCs will settle? So we will just measure the length from the RBCs at the top of the tube. If the length increase, then the ESR will become increase. It means that the ESR is directly proportional to the length. If the length increase, then the ESR will also increase. If the length decrease, length from the top of the tube at the top of the RBCs. So if the length decrease, then the ESR will be the decrease. So there are different factors that are actually involved in the settling of the RBCs. So it's simply a ESR. So in normal situation, RBCs carry negative charge. Okay, if you see here, like here, two RBCs. Okay, and these RBCs carry the negative charge. That's normal. Actually, negative charge help in the proper flowing or circulations of the blood, because when the RBCs flow in the blood vessel, so negative charge actually help in the proper flowing of the blood. If the negative charge removed, then the RBCs come across and form a aggregate. So due to the preventions of the formations of aggregation, RBCs nature already present the negative charge on the RBCs. So that's why the RBCs flow properly in our blood circulation. Okay, but in abnormal situation, when the specific protein fibrinogen increase in our body, then what will happen? So in this case, the fibrinogen masks the negative charge of the RBCs. If the negative charge of the RBCs mask, then what will happen? The RBCs come across and form a Rouleaux, that is called Rouleaux formation. it will form a just aggregation of the RBCs. So it's mean that the negative charge on the RBCs help in the proper flowing. Okay. The question is actually ESR is actually non-specific test in which see like in different situation our ESR become increase and decrease. Then it is not specific that in this disease ESR will increase and in this disease ESR will decrease. There are a lot of different diseases in which ESR increase and there are a lot of different diseases in which ESR decrease. So then why we do ESR? The question, because ESR help in the diagnosis of the different diseases, not even specific, because patient history, when a patient comes to a physician, then the physician will take the history of the patient and the clinical symptoms and the ESR. So physician will combine all these things and diagnose the specific point of the patient. So that's why ESR help in the diagnosis, not specifically, but it help in the diagnosis of the patient. So that's why we do ESR. So if we discuss the different factors, so there are three most important: physiological, laboratory, and the clinical. So first of all, if we discuss the physiological, so first factor is the plasma factor. So if you see here, first of all, we will see in what situation we see the increase in ESR and in what situation we see the decrease in ESR. So as we have discussed that the ESR become increased when the fibrinogen like, and you can say cholesterol become increase in our body. Why? Because fibrinogen masks the negative charge and the repulsion will reduce and RBCs will rapidly settle down, and when the RBCs rapidly settle down, the length will increase, so ESR will increase. When you see the fibrinogen increase, then ESR will increase. But in the when the albumin concentration increase, then ESR will decrease. Why? Because the albumin will viscous the blood, and when the blood become viscous, the settling of the RBCs will reduce in just 1 hour. So that's why when the albumin concentration high in blood, then the settling will reduce and ultimately the length will be the reduced. So this is another reason. Second factor, three most important, that is related to the RBC. We first of all discussed according to the number. Okay, number of the RBCs. First one is the number of the RBCs. Second, we will discuss the size of the RBCs, and third, we will discuss with the shape of the RBC. Okay, if you see here, first of all, when the RBCs number increase, then what will happen? Then the ESR will become decrease. ESR will become decrease. Why? Because if you see here like this way, here is the tube. When the RBCs increase, then ultimately the ESR form at the top of the tube will be reduced, because the length, because in the high concentration the RBCs settling down will reduce. Okay, when the opposite will be when the RBCs concentration decrease, then what will happen? The ESR will increase because there is low number of RBCs, and when the RBCs number is reduced, the let's suppose a small amount of the RBCs will settling down will faster as compared to the large number of the RBCs. So this is another reason. Okay, next we will discuss the size. So most importantly, we will discuss two sizes. So as we know that the two most important, microcytic and macrocytic. Okay, when the size of the RBCs become reduced, that is microcyte, the ESR will reduce. Why? Because when the RBC size small, then the settling of the RBCs will be slow and ESR will be the low. So this is another reason. ESR will be the low when you will see the microcytes. This is another reason. But when we see the macrocyte, large size of the RBCs, then as we know that the heavier object move faster relative to the lighter object. So macrocyte will settle faster as compared to the microcyte. So in this case, ESR will be the high because macrocyte settle faster. Okay. If we discuss the shape, so most important, if you see like the sickle shape RBCs, and you can say spherocytes. So actually abnormal shapes creates hindrance in the settling. So in this case ESR will be the low. So in the sickle cell you see the ESR will be the low. Okay. Next is the age and sex. So if you see here, like first if you see the infant, or you can say baby. In the baby, normally RBCs count increase. So if there is large, as we have discussed, that if the RBCs number increase, then the ESR will be the decrease. So that's why the ESR will be decrease in the infant. Okay. And if we move towards the adult, and in the adult, the RBCs count will decrease. So it means that the ESR will start increasing in adult age. But in the old age, if we see old age, the ESR will also be increased, because it is considered that in the old age you will see the increase in the fibrinogen. When the fibrinogen is increased, they mask the negative charge, and the RBCs will start settling with faster speed. So ESR will become increased. So this is the old. If we discuss the sex, male and female, in the female and the male, in the female we see the ESR will be the high. So in the female ESR high. Why? Because the RBCs number in the female is low. So slow number of the RBCs will settle faster as compared to the large number of RBCs. So in this case, in the male, the ESR will be the low. And last is the pregnancy. In the pregnancy, this is most important point. In the pregnancy, you will see the ESR will be the high. Why? Because in the pregnancy, you will see the hemodilution. So plasma level increase. The RBCs number relatively will become reduced. So it is actually a form of anemia. So in this case, in the pregnancy, when you see the hemodilution, the RBCs count will decrease. When the RBCs count decrease, so when the RBCs count decrease, the ESR will become increase. So that is the reason that why ESR increase in the pregnancy. Next is the laboratorical. Laboratorical, we do ESR at the room temperature, that is 20 to 25 degree. Okay. But ESR is directly proportional to temperature. When we increase the temperature, the ESR will also be increased. So it is say that the 3 degree Celsius increase cause the 1 millimeter increase in ESR, because the ESR reading is actually measuring millimeter. Okay. Next is the time. When we increase the time, then what will happen? The ESR obviously will increase, because in the ESR, normally when we increase the time, the RBCs will settle more. When we increase time from 2 hours, let's suppose if I say, if I increase the time to 2 hours, then the RBCs will settle more relatively that settle in the 1 hour. Okay. Next is the anticoagulant. We normally use 2 most important anticoagulant, EDTA and the trisodium citrate. So these are basically the 2 most important anticoagulant, and that will depend on the method in which you will do the ESR. Second is the tube factor. So tube length also play an important role, because tube length is directly proportional to ESR length. If we increase the length of the tube, the ESR will become increase. Next is the angle. Angle also play an important role. Again, ESR is again directly proportional to the angle. If we increase the angle of the tube, in the ESR, the tube should be vertical. Okay, this tube should be vertical. But when we increase the angle or tilt the tube, then the ESR will become increased. Why? Because the RBCs will speedily settle down at the bottom. Okay. Next is the vibration. When you see the formation of these three different layers, then in this case, when we suddenly shake this file, then what will happen? The RBCs that is settled down will start moving upward and again downward. So it's mean that the ESR will disturb. So it's mean that the ESR, if we vibrate the tube, then the ESR will become reduced. So in this case, the ESR will be reduced because RBCs will start moving upward and the length of the top of the vial will reduce. Okay. Next is the sunlight. Sunlight increase the ESR. So because in the sunlight you will see it provides the heat, and in the heat the RBCs start settling with faster due to the sunlight. Okay. Next, if before we start clinical, you should know that the three most important stages. So that is actually involved in the ESR. First one, when the RBCs start settling, they go through the three phases. First one is the Rouleaux formation, or you can say formation of the aggregation. The RBCs form the aggregate. Next step is the sedimentation, or you can say settling. After that, after the formations of the Rouleaux, RBCs start settling. Okay, and last is the if I say the last will be the packing, in which the RBCs start packing at the bottom of the tube. So these are basically the three phases. Okay, that will take the 10 minutes, that will take the 40, and packing will also take the 10 minutes. The total will be 1 hour. Okay, next if we see the clinical, this is most important. Okay, in what situation we see the increase in ESR, and in what situation we see the decrease in ESR. So first of all, in the pregnancy, as we have discussed, in the pregnancy the ESR will be the high due to the hemodilution. So first factor in which you will see the ESR will be the high in the pregnancy. Okay. Next important, in what situation? In the anemia. As we have discussed, when the RBC is reduced, then you will see the ESR will be the high. We have already discussed. So in the anemia, you also see the ESR will be the high. Okay. Next is the TB. So in the TB, you also tuberculosis, you also see the high in the ESR, because you will see in the TB you also see the different formations of the different proteins that actually marks the negative charge, and when the negative charge become marked, then the ESR will increase. Okay, and most important, II. You will remember it with the II. I for infections and the inflammatory condition. So two most important things in the infection and the inflammatory condition, you also see the increase in the ESR. Infection can be acute and the chronic. In both infection, you will see the increase in ESR. The reason will be the same formations of the protein. Okay. Next, if you see rheumatic fever. Rheumatic fever, also in the rheumatic fever you will see the increase in the ESR. Next is the macrocyte, which we have already discussed. In the macro, the size of the RBCs increase and the RBCs will settle because of the heavier mass. So we have discussed it. In the macro, the ESR will be the high. So these are basically the different clinical condition in which you will see the ESR will be the increase. So it's quite difficult that in different condition we see the increase in ESR. Then how can physician diagnose that it's pregnancy, it can be anemia, it can be TB, it can be infection? No. Let's suppose if I say the patient, I don't know the patient whether patient is suffering from fever, suffering from TB. So in this case, I do ESR, in which ESR will be the high. Along with that, we also see the clinical symptoms of the TB, and I also go for other tests like sputum tests and different tests that will confirm the patient having TB. So we can't only rely on the ESR. It's not say perfect test. It's just give a clue to us to diagnose the specific disease. Okay. Next, if you see in what condition the ESR will be reduced. Hyperviscosity. In the hyperviscosity condition. These hyperviscosity can be due to increase in the different proteins in the blood. So hyperviscosity hinders the settling of the RBCs and due to which the ESR will be reduced. Next is the polycythemia. Polycythemia, when the RBCs number increase. Okay. In the polycythemia, we also decrease the ESR because as we have discussed, the RBCs number increase, the ESR will be reduced, which we have already discussed. Next, if you see like low fibrinogen, when the fibrinogen become reduced in our body, then there is no factor that will mark the negative charge of the RBCs, and due to which the RBCs will settle slowly. Why? Due to the repulsion of the negative charge between the RBCs. So that's why when fibrinogen reduced, the ESR will also be reduced. Next is the sickle cell, which we have already discussed again, that the sickle abnormal shape will also create the hindrance in the settling of the RBCs, and that's why the ESR will be reduced. And opposite will be the micro. That's we also again, these are we have already discussed all these factors. So in the micro condition, you will see the reduced ESR. So this is opposite, macro and micro, anemia and polycythemia. So they are just opposite in their condition, in which you will see the increase in ESR and the reduces ESR. So this is all about the ESR. If you have any question, you may ask in the comment section. Thank you so much.